Is your low back pain caused by arthritis or something deeper? Welcome back to my series of videos addressing the 5 most common spine issues. My name is Dr. Jay Bowen, and my goal is to treat pain with regenerative medicine at New Jersey Regenerative Institute. This is the 3rd edition to the segments of speaking about spine issues, and this one is going to address degeneration, or what's also known as lumbar spondylosis. Spondylosis is just a fancy medical term for arthritis or wear and tear of your spine, and lumbar is your low back. Like we talked about earlier, it can cause pinched nerves by narrowing the space through which they pass, but degeneration itself can be painful, even without nerve compression. Your spine is built up of vertebral bodies stacked one on top of each other with discs acting like cushions between them. As you can see here, a vertebral body or bone with disc and disc as they pile up. With age or with too much stress, these discs start to break down and people can develop what's called discogenic pain or pain from the disc itself. The tricky part is we don't have a perfect test to confirm disc pain. We know that as discs degenerate, new nerve fibers can grow into them, and those nerves can become overactive or hypersensitive. But the pain might not be coming from the disc in isolation or even at all. Another suspect? Well, the end plates. These are the bony surfaces that contact the disc on the top and the bottom between each vertebrae. And this can be a hidden or even unrecognized source of the pain too. The spine is made up of many bones or vertebral bodies and discs piled high, as we talked about earlier. But something needs to hold these things together. So ligaments will connect bone to bone, and muscles overlie these structures for dynamic stability as well as moving the spine. As I discussed before, posture and mechanics of the spine are very important. If these are impaired, the connecting tissues of ligaments and muscles break down or degenerate, and they can't perform the job they're intended. Please refer to the video for more details that I talk about a lumbar sprain or strain. These muscles, as well as the discs and bones, have lots of nerve supply, and they can be the primary source of pain, or if they don't work correctly, they can lead to overloading the discs or the facet joints, which are these small joints on the back side of the spine, and cause pain from the degeneration. These abnormalities can be addressed with regenerative medicine, such as platelet-rich plasma or PRP. Now, there's another key piece in this degenerative story. The facet joints that I just mentioned are also known as zygapophyseal joints. These are small joints on the back side of the spine, right here. They essentially make up from the vertebral body above and the vertebral body below, and that makes a joint. In a healthy spine, they carry about 1/3 of the body's load. But when the discs degenerate in front of the joints, they can end up having translative force and carry up to 70% of the load, which is way more than they're built for. The added stress causes wear, inflammation, pain, and the development of arthritis. You'll usually feel it in your low back, but sometimes it spreads even into the buttocks or the back of the thighs. To figure out if the pain is coming from these little joints, I would perform a diagnostic block where I use a tiny amount of numbing medication or anesthetic around the nerves that supply these joints. If it relieves your pain, we repeat the test to confirm it. Once confirmed, the standard treatment would be a radiofrequency ablation. That's where these tiny nerves are burned to stop them from carrying pain signals. This is a semi-definitive procedure that can give you relief for about 12 to 18 months. My personal approach? Instead of destroying nerves, I prefer to support healing. That's where platelet-rich plasma or PRP comes in. Using your own body's growth factors, we can inject PRP into the facet joints, or even better, additionally to the surrounding ligaments at joint capsules. I've seen people with so-called disc pain that get better just by stabilizing these structures. This can avoid disc procedures or even surgery that are more invasive with greater risks. At the end of the day, whether the pain is coming from the disc, the end plate, or the joint, most people really don't care. They just want to feel better. And if you can do that without more damage, that's a win. So thanks for watching. In our next video, I'll dive deeper into the sacroiliac joint dysfunction and what really causes that stubborn pain in the butt, literally. Using your own body's growth factors, we can inject PRP into the facet joints, or even better, additionally to the surrounding ligaments, add joint capsules. I've seen people with so-called disc pain that get better just by stabilizing these structures. This can avoid disc procedures or even surgery that are more invasive with greater risks. At the end of the day, whether the pain is coming from the disc, the end plate, or the joint, most people really don't care. They just want to feel better. And if you can do that without more damage, that's a win. So thanks for watching. In our next video, I'll dive deeper into the sacroiliac joint dysfunction and what really causes that stubborn pain in the butt, literally.